Hello people, namaste, welcome back to my channel. In this video, I will explain the communicable diseases from community medicine. So I will explain all these communicable diseases in coming videos. First, I will discuss about the smallpox and chickenpox in this video. Okay, first we will discuss the smallpox, chickenpox. These are the short answer questions for university exams. Uh, Chickenpox. First is chickenpox. Chickenpox is also called as varicella. Chickenpox is also called as varicella. Why varicella means it is caused by varicella virus. So we called it as varicella. First, we will discuss about the epidemiological determinants like agent factor, host factor, and environmental factor. Agent factor. In agent factor, there are four subheadings are there. First one is agent, source of infection, period of communicability, secondary attack rate. Agent. What is the agent of chickenpox? Is varicella zoster virus. This is human herpes virus 3. HHV3 human herpes virus 3 varicella zoster virus. It is double stranded DNA. So what is agent? Varicella zoster virus, which is a human herpes 3, it is double stranded DNA. Next come to the source of infection, like cases like person to person transmission. Next oropharyngeal secretions. Next skin and mucosal lesions. So these are the sources of infections of chickenpox. Next, period of communicability. Rashes present in chickenpox. Rashes present. So before rash and after rash, there is a communicability of the disease will occur most commonly. So before rash, how many days before rash? Like 1-2 days before rash, and after 4 to 5 days after the rash, there is a period of communicability is present. Next, secondary attack rate is 90% of chances for secondary attack rate. So this is the agent factor. Next comes to the host factor. Host factor is age. First we will discuss about the age, immunity, pregnancy, all this. Age like children's. Both males and females both have same susceptibility for the this chickenpox. Okay, age is children's less than 10 years. Immunity, when it affect, it is a lifelong immunity. Next, in pregnancy, if the infection occurs in pregnancy to the mother, it is also called as congenital varicella syndrome. What is called congenital varicella syndrome? So some of the complications when this disease comes in pregnancy, what happened to that child? See, maternal varicella may cause fetal wastage and fetal defect. When the varicella comes to the mother, it leads to so many defects in the fetus, and the fetal wastages occur. So what are the defects and what are the other conditions to that fetus? So first is cutaneous scars. Next, atrophied limbs. Next one is microcephaly, low birth weight. Next, cataract formation, microphthalmus, deafness, chorioretinitis, and cerebrocortical atrophy. How you can remember? Say, first comes to the brain like microcephaly, small brain, microcephaly, cerebrocortical atrophy. Okay. Next comes to the eye like cataract, microphthalmus. Next, chorioretinitis. Next comes to ear, deafness. Next comes to skin, cutaneous scar. Next, atrophied limb. Okay, the next one is low birth weight. These are some of the complications when the this chickenpox comes to the mother, leads to the what are the defects comes to the child. So these are the host factors. What are the host factors? 3 I discussed, like agent, immunity, pregnancy. Next comes to the environmental factors. Environmental factors is called seasonal distribution. Because of season it occurs. So what type of season? Like winter and early spring. What is that? Winter and early spring is the main common like the distribution of chickenpox, winter and early spring. What is mode of transmission? Like droplet infection and droplet nuclei. Because of droplet infection, droplet nuclei, and vertical transmission also occurs. So I also discussed about the congenital varicella syndrome now. So it is called vertical transmission. Next comes to the incubation period. You can remember each one of the incubation period. These are very, very important incubation periods for each communicable disease. So comes to the chickenpox like 14 to 16 days. 14 to 16 days chickenpox incubation period. Next comes to the clinical features. Clinical features like two types, like pre-eruptive stage and eruptive stage. What is pre-eruptive stage? What is eruptive stage? Pre-eruptive stage like fever, malaise, shivering, pain in the back. So in back, pain will be there, fever is common, and malaise is common, and shivering is present in pre-eruptive stage. Next comes to the eruptive stage. What are the eruptive stages? Like first we can discuss about like 3 points, like a distribution, location, characteristics. 3 points. What is that? First we should discuss about the location. Next comes to the distribution. Next comes to the characteristics of the Rash. See, in eruptive stage, same fever is present here also, but we will discuss about the rash in this eruptive stage. Come here, pain in the back, malaise, fever, shivering will be present. Along with fever, here rash is present in eruptive stage. So, what is the distribution of rash? What is the location of the rash? What is the characteristics of rash? See, first location. First, we will discuss about the distribution. Distribution, it is symmetrically and it is centripetal in direction. It is centripetal. So, this is the difference between the chickenpox and smallpox. Here, chickenpox it is centripetal, but in smallpox it is centrifugal. Okay, this is centripetal in direction. Okay, next comes to the location. Location means appears on the trunk. This rash first comes to the trunk. After the trunk, it goes to the face, arms, legs, except palms and soles. In palms and soles, no rash is present in chickenpox. Okay, first occurs at the trunk. Next come to the face, arms and legs. First the characteristics of rash. Before going the characteristics, first how the rashes appears. Like stages are present. Like 4 stages: macule, papule, vesicle, and scab. What is it? Macule, papule, and vesicle and scab are present in this rash. Next, we will discuss about the characteristics of the rash. Like these are the superficial. This is the distinguish between the rash of chickenpox and smallpox. First, you can know about the characteristics of chickenpox. Like first, it is superficial, which is important. Next, unilocular, and these are symmetrical. Okay, area of inflammation around the rash will be present. Next, it has a clear vesical fluid is present. It look like how it look like a dew drop on the rose petal. On the rose petal, dew drop is present. So it present as like the vesicular fluid is present in that rash. In that vesicle is present, it consists of fluid like clear fluid is present. So this is one of the characteristics. Next comes to the pleomorphism, which is important. It means all stages are present simultaneously at one time only. Pleomorphism is present in chickenpox. Next, after that, macule, papule, vesicle infection, like vesicles fluid is present. This fluid acts as an infection. Next comes to the scab. Next comes scab. Scab from 4 to 5 days, which is non-infectious, whereas vesicular fluid is infective. Scab from 4 to 5 days. Okay, these are the characteristics of rash. First one is superficial, unilocular, symmetrical. Here centripetal in direction. Okay, centripetal, and the area of inflammation is present around the rash. It looked like a clear. It is a clear. It has an like a clear vesicles. Fluid contains vesicles. It looks like a dew drop like. On rose petal, and it has pleomorphism, and scab which is non-infective from forms from 4 to 5 days, and vesicular fluid is also present, which is infective. Okay, next comes to the complications. Complications like what are the complications of chickenpox? Generally seen in 1% cases, like 2 important complications like shingles and varicella pneumonia. Most dangerous complication because of this chickenpox of varicella zoster virus is varicella pneumonia. Most least common complication, late common, not least, late common complication of chickenpox is shingles. Next, other hemorrhage and encephalitis are also present. So you can remember these two, like shingles and the varicella pneumonia. Next comes to the diagnosis. Diagnosis like clinical findings are present. PCR by using clinical diagnosis by using PCR by examination of this vesicular fluid under electron microscopy. Most rapid and sensitive test is present. This is the important, very very important. Like prevention is very very important in this. Chickenpox, like there are 2 types of immunization, like active immunization, passive immunization. What is active immunization? What is the vaccine should be given in chickenpox? Is see, what is the strain of this varicella vaccine? Varicella vaccine is Oka strain. Kinds of Oka strain. It is a live vaccine. Varicella vaccine is a live vaccine. How much amount of dose? Like 0.5 ml subcutaneously you can given. It varicella vaccine gives it 2 schedules, two doses. Like 2 doses. What are the two? When will be given 2 doses? Like 2 to 18 days, 2 to 18 months. Between 12 to 18 months, we can give the 2 doses. So what is the gap between these 2 doses? Is gap time interval between 2 doses like 4 weeks to 3 months. First you can take the between 12 to 18 months. These 2 doses can be given. First you can take 1 dose, and there is a gap between the 2 doses like 4 weeks to 3 months is present. Okay, next you can also take the booster dose like 4 to 5 years. So this is important. Okay, 4 to 5 years. Here you can remember like 12 to 18 months. Okay, 12 to 18 months. So each dose gap between 4 weeks to 3 months. Next, like these 2 doses, like 12 to 18 months means we can given these doses for the children like 12 months to 12 years. Up to 12 months to 12 years we can given these 2 doses with a gap of like 4 weeks to 3 months. Combination vaccine also present. Not only varicella, we can combine this varicella in MMR vaccine, like MMRV vaccine. from 9 months to 12 years. Next, post prophylaxis. Post exposure prophylaxis is to known exposure of varicella virus. Give Oka vaccine within 5 days of exposure. When we expose to the Oka virus, we can give this post varicella Oka or varicella vaccine for post exposure prophylaxis. Next comes the passive immunization. Passive immunization like varicella zoster immunoglobulins. Passive means immunoglobulins can be given. So varicella zoster immunoglobulins given within 72 hours of exposure. Within 72 hours we can give this varicella zoster immunoglobulins. What are the indications? Like these immunoglobulins also given for immunosuppressive patients, HIV, AIDS, pregnant women, low birth weight, early neonatal, premature infants. All this can we can give this. All these persons we can give this immunoglobulins, varicella zoster immunoglobulins. Next, what is the dose? This is important. Like 12.5 unit per kg body weight to maximum of 625 units intramuscular. What is it? 625 units. 12.5 unit per kg per body weight to maximum of 625 units intramuscular. Repeat this dose in every 3 weeks if the high risk patient remain exposed. If the patient again exposed, so we can given this repeat immunoglobulins can be given for every 3 months. What is the dose? 12.5 kg per body unit per kg per body weight to a maximum of 625 units intramuscularly. You can given this passive immunization varicella zoster immunoglobulins. Next, we can tell about the control measures. Like we should notify the case. Where is the notification? Next, we can isolate the case and disinfection of articles and antiviral therapy. This is a virus. Now, you can give antiviral therapy like acyclovir, valcyclovir, femicyclovir, foscarnet. All this can be given. Next comes to we can know just for bits. We can know about the difference between chickenpox and smallpox. In general, the smallpox eradicated globally at 8th May 1980. Already it is eradicated like 1990 8th May. Okay. Next comes to the difference between chickenpox and smallpox. Like incubation period I discussed previously. Like say, incubation period of chickenpox like see 7 to 21 days. Here 7 to 17 days. Okay. 7 to 21 days. 7 to 17. Generally, chickenpox incubation period is like 14 to 16 days only. How we can remember the difference between chickenpox and smallpox is chickenpox has more incubation period compared with the smallpox. You can remember like that. Prodromal symptoms are usually mild, no prodromal symptoms. Here, prodromal symptoms are present. So, we will discuss about the rash to compare the both of the chickenpox and smallpox. So, first, it is superficial, but it is deeply seated. Here, area of inflammation present around that rash. No inflammation around the rash. It is unilocular. I discussed previously unilocular, superficial. All this I discussed now, like unilocular, symmetrical, superficial. Here unilocular, here multilocular, here centripetal in direction, here centrifugal. Pleomorphism is present in chickenpox, pleomorphism in option is smallpox. Palms and soles are spared. Here how they form like from trunk to face, neck, arms and legs. No palms and no involvement of palms and soles. So this is spared. The palms and soles are spared, here not spared. They are, here smallpox, palms and soles also have rashes are present. These are rapid in evolution, this is slow in evolution. So this is the difference between chickenpox and smallpox. Okay. So this is a summary. So first, chickenpox means varicella. You can know about the agent. Agent factor has a agent, and you can tell about what is varicella zoster virus, like double stranded DNA. Next, period of communicability and source of infection. Cases, oropharyngeal secretion, skin and mucosal lesions. Period of communicability like 1 to 2 days before and after. After rash means 4 to 5 days after. Secondary attack rate is 90. Next comes to the host. Host like age, immunity and pregnancy. Age less than 10. Immunity means lifelong immunity. Once attack it gives lifelong immunity. Pregnancy like congenital varicella syndrome. So what are the symptoms? Like cutaneous scar, atrophied limbs. Next comes to the brain like microcephaly, cerebrocortical atrophy. Next comes to the eye like cataract, microphthalmus, choreo, retinitis, deafness, low birth weight. All these are defects for a child. Next comes to the environmental factors like winter and early spring. Mode of transmission, droplet infection and droplet nuclear and vertical transmission. In incubation period like 14 to 16 days. Next comes to clinical features like pre-eruptive stage and eruptive stage. Pre-eruptive have fever, malaise, shivering, pain in back. But here eruptive we can discuss about the rash. How rash is present, how located, how distributed. Location is the first location is appears on the trunk like face, arms and legs, spared of palms and soles. So here centripetally in distribution. Rashes like macule, papule, vesicle and scab. How it is present like superficial, multilocular, unilocular, symmetrical. superficial, unilocular, super symmetrical area of inflammation around the rash, like clear fluid is present, pleomorphism is present, scab from 4 to 5 days is for also present. The complications are discussed, two types of complications. So late complications, they will ask in bit what are the chickenpox late complication is shingles. Shingles is the chickenpox late complication, or dangerous complication is varicella pneumonia. Diagnosis you can remember like PCR, clinical findings by knowing the rash findings. Okay, examination of this vesicular fluid. Okay, next comes to prevention. Prevention is varicella vaccine. Varicella vaccine is oca vaccine, oca strain 0.5 ml subcutaneously we can give it. It is a live vaccine and it has two doses, uh, from which age the child, this varicella vaccine given like 12 months to 12 years. In 12 months to 12 years, between these we in this years we can give two doses, like two doses with a gap of how many, 4 weeks to 3 months. Okay, combined vaccines by we can combine this varicella vaccine into MMR, like MMRV vaccine. Next comes to post prophylaxis vaccine. In post prophylaxis vaccine, when there is exposure of this varicella, we can give oca vaccine for 5 days, within 5 days. How many days? Within 5 days of exposure. Next come to the passive immunization. Passive immunization we can give immunoglobulin, like varicella zoster immunoglobulin within 72 hours of exposure, within 72 hours. Post prophylaxis within 5 days. Here passive immunization within 72 hours of exposure. Indicators all should be like, you can remember like early neonate, premature infants, all children's also we can give this varicella, the MMRV vaccine. What is the dose? Like 12.5 mg units per kg per body weight for 625 units of intramuscular. Repeat this dose if there are 3 weeks, if there is any risk. Now next comes to the control is isolation, disinfection, antiviral therapy, all should be given. So sometimes they will ask in bits what is the prevention means we can write about the active immunization, about the varicella vaccine. Next, post prophylaxis also you can write. Next, immunoglobulins, like passive immunoglobulins you can write about this, what is the dose is important. Next comes to the control, like notification, isolation, disinfection and antiviral therapy, you can write this. Okay, sometimes they will ask in short. Thank you. Please subscribe my channel and please support us. Thank you.